Hello and welcome to this week's Swedish Facebook Live. I'm Mona Locke, Chief Communications Officer here at Swedish. We're the largest nonprofit healthcare system in Washington State with 5 hospital campuses, 115 clinics, and 2 freestanding emergency departments. And Seattle was hit hard when COVID-19 hit us, and Swedish was at the forefront of fighting this pandemic. So we thought this Facebook Live opportunity was a great opportunity to give you, the public, the information you need firsthand. So please remember to chat in your questions and we'll try to get them answered real time. As you have heard in the news nationally, healthcare systems have taken quite a hit from this pandemic. Not only were we faced with trying to figure out what this virus was and how to get our arms around it, but also to care for our patients and to make sure that our patients and caregivers were safe. So today's topic is really focused on the recovery, with our expectation that Governor Inslee will lift the elective surgery ban this next coming week. We are in preparations to recover and reopen our operations, but things have changed since COVID hit. You know, we had to shut down a lot of the operations to focus on COVID. So how are we recovering from that, and how can you, the public, know that you're safe? And so that's why we're here to answer your questions. We're going to start today with a great panel. Our CEO, Dr. Guy Hudson, is here with us, as well as a couple of our leads on surgical. So we'll start with Dr. Guy Hudson. Please introduce yourself and give us a little bit lay of the land on COVID-19 and our recovery.
Great. Hey, thanks, Mona. It's good to be here. It's good to see everybody again. I'm Dr. Guy Hudson. I'm the Chief Executive Officer for Swedish Health Services. I've been at Swedish 13 years. I've been in the role of CEO for 3, and it's good to be here. Thanks, Mona.
Thank you. And next up, we have Dr. Ruth Simmons. Can you please give us some words of introduction?
Yeah. Hi, Mona. Thanks for having us. I'm Ruth Simmons. I'm an anesthesiologist. I've been with Swedish for 9 years. Prior to that, though, I rotated through Swedish as a resident, and I'm the co-executive medical director of surgical services for Swedish.
And last but not least, we have Dr. Mark Horton.
Hi, I am Mark Horton. I'm the System Executive Medical Director for Surgical Services, the Surgical Chair. I also run the Swedish General Surgery Residency Program, and I still have a clinical practice as a member of the Swedish Surgical Specialists. Come 2 weeks from now, I will have been here for 32 years.
That's quite an accomplishment. So happy anniversary in advance. I wanted to start out today with really Dr. Hudson and asking you to give us the kind of the lay of the land in the healthcare system right now. Since COVID has hit, where do we stand as healthcare systems, not just like Swedish, but across the state and across the country?
Great, thanks, Mona. And by the way, I'm proud to be here with my colleagues virtually. I've interacted with them for years, and the expertise that we have in the room and at Swedish, I think, is one of the main reasons why we've been able not only to protect our caregivers and patients, but also make such advancements in the field of patient care and research. So it's interesting being on the West Coast, especially in the Pacific Northwest, and being one of the first health systems to see coronavirus and subsequent COVID-19 enter our health system. And being the first to go, it's the World Health Organization guidelines and the CDC guidelines as they're still coming to fruition and being formed, and the society guidelines that we rely on. The expertise at Swedish has really been at the forefront for helping shape what that looks like, not only locally but nationally, not only to make sure that you're safe in getting the care if you have a health problem, but also helping lead the state as well as the nation as this started to spread to the east. We are fortunate, I would say, not to have some of the extremes of COVID-19 in our hospitals, such as our colleagues on the East Coast. And a lot of that's thanks to Governor Inslee's stay-at-home, stay healthy order. And at that time, with the proclamation of closing down elective surgeries, we were able to flex down our volumes quite a bit in our hospitals, not only to get the personal protective equipment and ramp up the testing that we need, but also to make sure our facilities had capacity to serve you if that surged and peaked the way that it was suspected to peak. But given the fast actions of the state, the camaraderie that we've had around the state with the different health systems, and the expertise that we have in the organization, and several here on the Facebook Live with us and to talk to you, we had a plateau that we're now on the downswing of, and the safety and the personal protective equipment, the ability to testing has advanced so much in the past 8 weeks that I'd say that we have not wavered a step in the safety of providing you that comfort to know that we can provide the best healthcare and the safest healthcare when you need it. Yeah,
and the reality too is though that we shifted a lot of our resources really to COVID-19 and shut down some of the other operations and functions that the hospital normally does. What is the state of Swedish, and it's not just Swedish, right, but other healthcare systems?
Great, thanks, Mona. Well, I think everybody's seen the news, particularly in regards to the hit on the national economy, with small businesses closing, unemployment rates rising, and even those of you that are finding the headlines, 1.4 million healthcare workers are finding themselves out of a job across the country. We've been very fortunate. We have such a great caregiver and workforce here that we have complemented and supported our people throughout this crisis as best as we can in all avenues across all sectors. And as the business economy fluctuates and as we see the rates of unemployment rise, we are continuing on our mission to serve everybody regardless of their ability to pay, as well as continue to serve our communities in all aspects of their care. In doing so, and the fact that we saw such decreases in volume as we were expecting this increased rise when coronavirus was heading up the slope to get to a peak, toning down our operations, we really took a financial, I'd say, a hit where we were losing millions of dollars a day in net revenue as we kept our capacity open to serve you in our communities. And so all health systems across the country, and Swedish is no exception, are suffering financial difficulties as a result of this. The federal government has stepped up in regards to distributing funds from the CARES Act, and we have received funds from the federal government, which has helped, but it still only covers about a little less than a quarter of our anticipated losses as we go forth and into the rest of the year. And it also does not count for the fact that there is a concern regarding a potential second surge when the flu season hits in the fall.
So Swedish has taken some steps, right, to recover. Can we elaborate on that a little?
I think it really goes, and I've been very proud of people. I think one of the things to make sure that what we've done to get care where we need it is we really ramped up in telehealth and virtual care. I've seen such an increased use of the platforms that you can access to get a hold of your provider or your specialist, where we can get you care when you need it, and sometimes the comfort of your own home. And so that innovative technology has ramped up quite a bit. And I would expect that to continue because it's such a great avenue and a way for you to connect with your provider.
Yeah, COVID really has changed the way that we do healthcare and the public does healthcare. And so, but say I have to have surgery and we're expecting this ban to be lifted or the order to be lifted by the governor next week, and say I have to have surgery, how do I feel safe coming into the hospital?
Well, I would turn it over to the experts in the room. We have Dr. Simmons and Dr. Horton here that not only led the way for Swedish, but developed protocols and safety mechanisms, not only that we've used at Swedish, but have been used across several health systems across the Western states. And so I'd turn it over to them and get their expertise.
Yeah, thanks, Guy. So we've done many things throughout this whole process over the past many weeks to keep our patients safe. And as we get ready for resuming more surgeries, we're really trying to, we have staff that has adequate PPE. Over the past 8 weeks, we've made sure that we partnered with our infection prevention physicians and infection prevention colleagues to make sure we have the state-of-the-art appropriate PPE for appropriate procedures. We're also doing things that other health systems are doing. We're making sure everyone who comes through our hospital is checked at an entry control point, making sure no one has any symptoms of COVID-19, that they don't have a temperature. Our caregivers, our providers, and our patients are all using masks on their way. We're using physical distancing. All those are measures that we're using throughout the ambulatory space and the surgical space to make sure patients are really safe. We also are just implementing pre-op COVID testing for our procedural patients 48 to 72 hours prior to surgery. And this is a moment where I was really proud of my Swedish colleagues. We were able to stand these clinics up and get this testing running to make sure that our patients feel safe and everyone who's working in the operating rooms and outside the operating rooms feel comforted and safe. I'll let Mark talk about it too.
We had a situation where we had to sort of instantaneously shut things down and go to urgent emergent cases only per the governor's mandate, which was the right thing to do for all the reasons we've already mentioned, to make sure that we had the space and the PPEs that we needed in case this surge hit. As that curve flattened, we were given a little bit more latitude with regard to what type of cases, those planned cases that were still more urgent but not emergent, and those were put into a group that we compiled a number of surgical experts, anesthesia experts, and we reviewed those cases twice a week to make sure that we weren't missing anybody that really still needed a surgical procedure but were within the governor's mandate. And we've done that, and as we've watched the curve stay low, our PPEs used be okay, have unit beds, intensive care unit beds and ventilators available, we did more and more of those cases with the hope that being that next week we can open up and continue to serve the population. Because the thing that's most important to us is the population of people that we're taking care of, first and foremost. Second of all, the safety of those of us that do that. Dr. Simmons is an anesthesiologist, I'm a surgeon. Our colleagues need to feel safe, as well as the nurses and all the other caregivers. And then, quite frankly, the financial life of our institution, so that we can continue to take care of those people that so much depend upon us.
And I think you touched on this, Dr. Horton, but how do you start reopening, and how do you decide which surgeries to schedule first?
Well, so what we did is we never canceled a surgery. We delayed surgeries or postponed them. We looked at ones that we felt were a necessity, and those went through. Then we prioritized those, and every week when we looked at these again, we looked at those and prioritized them. And cases, people would move up the list because something would change about them, so that we could get those done in a timely fashion. As we go into next week, and if things stay the way they are, there's been cases that have been scheduled out for months in advance, and then there's been open slots that we've filled up other cases with, so that we can start to resume and get people back to normal with regard to their surgical needs. This is only going to happen if the governor says it's all right, if we feel safe, and if our patients feel safe. And that's why the work that Dr. Simmons, myself, Melissa Short, and a ton of other people have done to get this preoperative testing done is going to be remarkable, because it's going to allow us to be able to improve our throughput and improve our safety and the safety that people feel coming in the hospital.
In a lot of cases, I'm told that the ramping up is much more difficult than even the ramping down when COVID first hit.
Well, I don't want to keep hogging the microphone here, Ruth, if you have anything you want to say.
No, I would say the ramping up is a lot harder than the ramping down, but I will say the institution that we are right now, we've always been a great institution, but over the past many weeks we have gotten stronger, and we've been able to coordinate our medical forces with our surgical forces, and really I feel like we know better how to handle the COVID patients, the patients coming in for other medical issues, and our surgical volumes. And I think we relied on our surgeons. We reviewed all our cases through the Surgical Review Committee, which is, as Dr. Horton said, multidisciplinary. But the surgeons know the patients that they have, and they know their specialty. And they were able to really come to this and show us, these are my 10 patients that absolutely have to go first. And we've partnered with them and I think ramped up nicely. It's very easy to turn off surgery, but turning it on in a thoughtful, meaningful way. And I think we have done a good job at that, really addressing the surgical needs of people in our community. As Dr. Horton said, that's our biggest focus.
Yeah, if I could mention one thing, I think it's, and hopefully the audience has picked up on this, that we rely on our experts in the field, whether it's infectious disease or the research endeavors that we've undergone with remdesivir and other antivirals, or even the plasma studies that we're involved in, are not only leading Northwest, but in some cases the nation. And it's the experts lead the way in this, whether it's our nursing corps who are on the front lines, our doctors, our researchers. Shout out to all the Swedish folks who are really the ones who have helped us not only keep it safe for you, but help us set those priorities to make sure that as we go through this pandemic, whatever this may look like, that we stay 1 to 2 steps ahead to make sure you get the care you need in a timely fashion. So my hat's off to Dr. Simmons and Dr. Horton especially, because they have really done a fine job making sure that we've always been prepared to take care of you when you need it.
And Dr. Hudson, to follow up a little bit, you're involved with WSHA, the Washington State Hospital Association, and I think it seems like healthcare systems have really pulled together and collaborated on this effort to fight this pandemic.
Yeah, Mona, if you include the Army Hospital and the behavioral health hospitals, we have 118 hospitals in the state of Washington. Many of those are represented by the Washington State Hospital Association or another association within the state that has been a collaborative effort when we look at just that coordination of care, communication with our elected officials, working in collaboration with the Regional COVID Command Center that is really headed up by Admiral Bono and other representatives of the state and the Department of Health. So the coordinated efforts that have transpired and matured over the past several weeks, if not the last month, has really helped coordinate a state response in partnership with the governor and in partnership with all the other healthcare agencies, including our friends at the Washington State Medical Association and others. So it's been one of the best examples of cooperativity in healthcare I've seen.
That's wonderful. And I just want to remind anyone out there to please chat in any questions you may have for our experts, because we're talking about recovery period with COVID-19 in our lives, and also how we start to reopen our operations in the healthcare systems, awaiting Governor Inslee's word on whether he will lift the order to stop elective surgeries. So say it's lifted and I come in and I'm a patient and I'm called to come in for surgery. What can I expect? I mean, I get the call from you, okay, we've scheduled the surgery now, it's the day before. Walk me through this process, Dr. Horton.
So the way it works right now, we're going to check everybody for COVID 48 to 72 hours, mostly 48 hours before surgery. So the sequence would be that you'd be scheduled for surgery on Wednesday. I'm going to talk about one of my own patients. He's going to come in on Monday and get a COVID test. He will be given some paperwork that will tell him how to go home and self-quarantine for 48 hours. That test will come back the next day. He'll be notified in the afternoon that he's negative and to proceed with surgery the next morning. And he'll come in and go through processes by which some social distancing and stuff that I'll let Dr. Simmons address with regard once you get in. If, heaven forbid, it should come back as an asymptomatic positive patient, then there's an algorithm about what exactly to do to get taken care of. Those numbers should be extremely low.
Right now with COVID-19 on the downswing, just so people understand, less than 10% of patients that are in our hospitals are COVID-19 positive. So the majority are not. We've done a good job with rapid turnaround testing. We isolate those that have any symptoms as we await testing. So you can be assured that we screen everyone, we test people ahead of time, and Dr. Horton mentioned that. So it's so critical that we make sure as we go forward that we test, we have the personal protective equipment, we are able to isolate when necessary, and that we have everyone, caregivers and you, protected at all times. And that is our utmost priority.
Dr. Simmons?
Yeah, and so to piggyback on that, once you come into our hospital, we do limit who comes in the hospital, and we make sure everyone who comes in is masked and is asymptomatic. That helps limit your exposure as well. It's probably safer than going to the grocery store, but both are safe. And then once you go back in pre-op, you meet your anesthesiologist, you meet your surgeon again, and your entire surgical team. We're all well versed. Again, we talked about collaboration. We've been spending the past couple weeks partnering with our nurse educators, our perioperative staff, and really drilling our protocol so everyone knows and feels comfortable with how we take care of patients moving forward. You have your procedure just like you would have had it 6 months ago. We take care of you. We focus on just one patient the entire time. And then we take you to recovery, and then you'll either stay inpatient or you'll be discharged. I think the only difference is your loved one will see you after your procedure. And otherwise, I feel very safe having surgery here. I think we've done a great job.
So you touched on the visitor or supporter policy. So what should I expect? And can someone come in with me on the day of the surgery?
So as we talked about earlier, we're really collaborating with the governor and with other hospitals. And so we're aligning our policies with all of these other hospitals. And so currently the policy is, of course, anyone 18 and under, their caregiver comes with them. If someone is elderly or frail, their caregiver also comes with them, and they're checked at the entry control points, and they accompany them to the pre-op area, then go to surgery yourself. But what we have stopped is having visitors besides for those patient populations coming with our patients. Instead, you'll leave a cell phone number. The nurses, the physicians, the surgeons, they'll call you, and then at the end of surgery, we'll coordinate a pickup time and, of course, give you the appropriate discharge instructions. At this time, we're not allowing people to have visitors if you're an inpatient. And again, we're collaborating with other area hospitals and with the governor to see where that policy lands. But again, all these policies, the ultimate goal is to make sure all of our patients who are having surgery stay safe. And there's also some exceptions for OB.
I think that's really important, and I think many of our patients have voiced this difference and the concern about that. And it's not falling on deaf ears. It's being done because it's the safest, soundest thing that we can do to make sure that you continue to be safe during your procedure, that people aren't exposed. I like to draw an analogy to what happened with 9/11. I remember clearly having to take, going and meeting my grandmother when she got off the gate at the airport, when she got off the plane. Those things you couldn't imagine when you were told you couldn't do that anymore. We've gotten to that point. I'm hoping that it will be a time when you'll be able to have visitation back in the hospital again. But in order for us to tell you that we're going to make you as safe as possible, we need to take that part away for right now.
And I think you touched on a little bit, Dr. Simmons, but say I have anxiety about this, right? And I get there's entry control points and that we are, temperatures, we're tested, we go in, but we're put under anesthesia, right? How do I know that, or what should I know about the time when I'm under anesthesia and the time when I wake up? How do I know I won't be exposed to COVID-19?
So you won't. So how do you know that is your anesthesiologist, your nurse, your surgeon, we all practice strict hand hygiene. We use masks. We have these protocols, this collaboration we were talking about. We have protocols for how we clean the room, how we make sure that every equipment is wiped down. And again, only one patient in the operating room at a time, and that is our focus for that period. Then when you go to recovery, we've reworked that so we make sure our patients aren't too close to each other. The same physical distancing that we've put into lines, we put into the operating room. And, the visitation policy is hard, but that is another example of how we're taking this very seriously, and we want our patient safety to be the first important thing.
And remember, our operating rooms are always sterile and clean.
Yep.
So that's not going to be any different. And so if we go to all of the effort we can to make sure that patients that go in that room are negative, and through this preoperative testing that we're doing, the likelihood of that being anything other than the perfect environment is extremely low and approaches zero.
And Dr. Hudson, I want to follow up a little bit about the recovery and the reopening of things if they continue to move on. How will decisions be made about the clinics, or if I'm a patient out there saying I've been putting off my healthcare experience, what are the opportunities?
Well, we've seen, and thank you for the question, Mona. We've seen people coming back into healthcare just looking at how our clinics are refilling with appointments and how people are accessing their provider in new and innovative ways, we've seen that increase quite a bit the last couple of weeks. And I think not only with coronavirus positivity or prevalence decreasing in our communities, but people are now re-engaging in their healthcare and re-engaging in ways to keep them healthy. So that is exceedingly important. It does not mean that you can't still, or you shouldn't still, hand hygiene is important. So Dr. Simmons mentioned this, wash your hands, right? Hand gel if you have it, wear masking when you're out and about, because we want to make sure that you're safe, but accessing your care right now is one of the safest things you can do. And please don't delay things when you actually need it most. And we've all heard those stories. They're out there where people waited a little bit too long. Please don't let that be you. We are safe and we're here for you to take care of you.
You just answered my next question about, is there any case where I should really delay surgery or think about delaying my care? But I think you just answered that. Dr. Horton, did you have something you want to say?
Just to build upon that, if you take yourself out of the elective population where you're not everybody's pre-tested and wait until something becomes emergent where we don't have the ability to test you, it actually it makes things worse for you and more problematic. So it's absolutely in your best interest to, in an elective situation, if you fulfilled the criteria, to be able to come in, be tested, and just like anything else, doing a procedure on somebody in a planned setting versus an emergent one is always better.
So thank you so much for your perspective and thoughts. And we're winding down our time now. What I like to do at the very end is kind of a round robin on your final thoughts for the public out there in respect to your position and what, I guess, conventional wisdom you can give them. So let's start with Dr. Horton.
I've been here for 32 years. 5 generations of my family has come here to get their care. This is still the right and best place to be. It's the safest, soundest time with regard to this pandemic for us to move forward. And you should feel confident that there's teams of people that have spent many a night and day making sure that we get everything squared away for you. And I wish you the best.
And Dr. Simmons?
I will piggyback on that. I've had care at Swedish for all 3 of my children, and the care's been amazing. And the partnership with nurses, doctors, infection prevention, we're ready to take care of you, and we're going to take care of you really safely.
Okay, and final words, Dr. Hudson.
Well, I think it's been evident on this Facebook Live. I am the proudest to be partnered with some of the best experts out there, and some of the people that you've been introduced to on this are the reason why I'm at Swedish and the reason I'm proud to lead it. I think as we look to bring businesses back online in the communities, in your community, and as people re-access and re-engage in their healthcare experiences, please protect yourselves, wash hands, gel, masking. Now's not the time to get back to old habits, just please. We don't want to see another surge. We don't want this to impact you and your families. So do the right thing, and we're always here for you.
And I always want to bring up that behavioral wellness side of take care of yourself so that you can take care of others. And I know people are cooped up and inside, and I think people with families and kids, it's driving them nuts or not, but I think appreciate those moments because it is a moment in time and everything changes so quickly as we see. So I want to thank all of our guests for being here today and giving us their thoughts about Swedish and really the healthcare systems in our state of recovery. And on behalf of Swedish, thank you for joining us.